The clotho protein is related to the regulation of oxidative stress and anti-inflammatory processes. Exercise is presented as a potent stimulator of the clotho protein, but who is Clotho? In Greek mythology, Clotho is the youngest of the Moirais, the goddesses of destiny. She was in charge of spinning the threads with her distaff. The strands represent human life, and that is where the gene gets its name, as it is known as a life-extending gene. The Clotho gene, which codes for a protein of the same name, has been called the suppressor gene of aging. Although interest in the control of aging is ancestral, the discovery of this gene and its protein were completely fortuitous. In 1987, Kuro O.M. and collaborators found a knockout mouse for this gene characterized by a phenotype of premature aging, hypokinesia, cognitive impairment, and sarcopenia. Since then, the study of this gene has been of great interest. Today, 3 isoforms of this protein are already described: alpha-clotho, beta-clotho, and gamma-clotho, the first being the original and best known. Alpha-clotho is secreted mainly in the kidney, parathyroid, and choroid plexus of the brain, and can also be found in lower concentrations in the pancreas, ovaries, testes, and skeletal muscle. Alpha-clotho in its circulating or secreted form has been associated with antioxidant, anti-inflammatory, and anti-proliferative effects in different tissues. In addition, it has been related to different pathologies, mainly chronic, and in which the effects of inflammatory processes, oxidative stress, or cell cycle dysregulation are characteristic of the disease. Elevated blood levels of clotho protein may help preserve kidney function. Although the very exact mechanism of action of clotho has not yet been identified, the protein has been shown to influence multiple cellular and endocrine pathways. The kidney has the highest levels of clotho expression and is probably the main source of soluble clotho, so it is not surprising that clotho levels tend to be low in patients with kidney disease. It was found a strong association between low soluble clotho and decreased kidney function, independent of many known risk factors for decreased kidney function. This protein is very helpful for the treatment of different conditions. Renal disease. Alpha-clotho is used as a powerful prognostic marker. It plays an important role in the prediction of cardiovascular events in these patients. Lung disease. Alpha-clotho is downregulated in airway epithelial cells in COPD patients. The secretion of pro-inflammatory interleukins can be regulated by this protein. Cancer. Alpha-clotho is a tumor suppressor factor. Many studies relate low levels of the protein in patients with breast, colon, or lung cancer, among others. In addition, high levels of this protein improve prognosis and increase survival in these patients. In some countries, gene therapies focusing on the clotho gene are already available, especially for improving kidney function or enhancing learning and cognitive function. We would like to hear your thoughts on this topic. Leave a comment. Lastly, remember that it is important to talk to a doctor or other professional before beginning any sort of supplementation or treatment. Feel free to contact us if you want us to give you the contact information of professionals who work with our network.